My name is...
Okay, please start.
start again.
Okay. Marhaba. My name is Anthony Risk. I'm 19, living in Lebanon, and a medical sciences student at university.
And my name is Ahmad. I'm 23 years old, and I'm doing my master's in public health.
We're both activists in the Lebanese LGBTIQ organization, Hilm, in Lebanon, which advocates for LGBT rights in the Arab world. We work on advocacy, reaching out to the community, and providing them with services that they may need.
Anthony and I work in the Health Outreach Unit, which is a youth task force in Hilm. We target issues of health. We pay close attention to sexual health because it's a very important issue that's tabooed and highly neglected in our community.
Now we work with a sexual health clinic that's connected to Hilm to bring services such as free HIV testing, counseling and STI screening to the community. We also work on outreaching to the community and providing them with information and making them aware of the issues related to health that they need to know.
We started the World AIDS campaign e-course earlier this year, and it was a very interesting experience for us. It provided us with valuable information and tools that we can use in our project later on. More specifically, it gave us the tools that we can use to understand the epidemic in our country and how to better effectively respond to it.
I also learned a lot from the e-course, especially about methodology and the methods we need to use in action plans and in our projects in order for them to become very efficient and sustainable. It's really helped us to determine what are the priorities in Lebanon and what we need to work on to reach our goals, which is why we're using the methods, tools and resources we have in the e-course to help us with our future activities.
We are now working on certain problems that limit the accessibility for HIV testing to youth in Lebanon. And we're doing that by targeting discrimination that people face in healthcare settings, more specifically in hospitals and clinics. We're planning on producing a guide which would actually illustrate best practice for healthcare providers that would eventually encourage youth and young people to better seek out needed services and to know their risk factors and their status.
Now the guide can be used by civil society organizations like Hilm to better advocate for the rights of youth living with HIV, and especially in the clinical and hospital environment. It can also be used by other organizations and healthcare practitioners that want to start clinics or have already started clinics or work in hospitals to initiate and sustain HIV programs. Now we want to thank the World AIDS Campaign for an excellent e-course that's really taught us a lot of valuable information. And all we can say is thank you and stay safe. So, goodbye.
Bye.
Cut. That was good. We're done.